primer. Hello, everybody. Really nice to meet you all. Very grateful to come and speak to you today about the Lovelace Institute and some of our work around algorithmic impact assessments. So my name is Lara Groves. I'm a researcher at ADA. And Sabine summed up ADA's mission very succinctly, which broadly is about ensuring that people and society are able to kind of partake in the benefits of technologies, data-driven technologies, specifically AI. And I work in our Ethics and Accountability in Practice program, which is broadly about we think about how we can translate kind of high-level normative principles of AI into kind of concrete on-the-ground practice, including some mechanisms like you might have heard of audits, of course, impact assessments, but also thinking about the kind of institutional context and how we can kind of broaden out some regulatory and legal levers and think about the kind of tech and society approaches to tackling some of the problems around data and AI. In my research at ADA, I'm interested in exploring tools and approaches that build public trust in use of AI systems, meaningfully engage the public in the development and evaluation of AI systems, and particularly create greater accountability for AI systems and the institutions that deploy them. So I'm going to speak probably for about 20 minutes on impact assessments and give you a bit of a kind of bird's eye view of what they look like before moving into our specific impact assessment process that we designed in partnership with the NIHR AI lab for a healthcare context. And as we mentioned, there'll be lots of time for questions and thoughts at the end. So you may have heard of an algorithmic impact assessment before, you may not have done, but the definition that we like to use is that they're a tool for assessing possible societal impacts of an algorithmic system before the system is in use. So they draw from a kind of long history of impact assessments, which are kind of domain neutral. And in fact, if you attended last month's session, Dr. Alison Crawford gave a really good insight into kind of health equity impact assessments. So impact assessments vary in kind of scope and uses, but a lot of the time the kind of substantive methodological components are quite similar. But essentially, they have kind of emerged in policy and industry circles, particularly in data and AI, and many of their proponents see them as a promising tool for creating greater accountability for algorithmic systems. But there's still kind of no standardized methodology for them as a nascent tool. There's not really a consensus around what an AIA might look like, and actually a key finding from our work is that there is no such thing as a one-size-fits-all algorithmic impact assessment. So they have been proposed, however, in different use cases, most often for kind of public sector uses, mandated in legislation, so particularly around kind of algorithmic decision-making and those kind of contexts. And to note that the current only live example is the Canadian government's algorithmic impact assessment tool, which they've mandated under their Directive for Automated Decision Making, which is kind of a sort of public procurement tool intended to be used by public servants in Canada. So it's a bit more kind of general. But yeah, in my view, AIAs are a kind of useful tool and warrant further exploration and research. And I think they add value in a few key ways. So firstly, they're not a compliance or a tick box exercise. It's not a case of, okay, I've completed the AIA and I've solved algorithmic bias and harm for my use context. They require a lot of kind of buy-in from both kind of internal team stakeholders, but also externally with, we would argue, members of the public. And the idea is that they should be iterated on at a regular cadence to incorporate new learnings and ensure that they have kind of long-term value. They provide specificity and granularity and a kind of more rounded contextual understanding of impacts. Impact, of course, is largely a tricky term, means lots of different things to different people. It's very hard to pin down what we mean by impact. So that's why a kind of case-specific AIA is important. So I would argue that healthcare AIA is obviously the kind of most targeted approach for thinking about these kinds of questions. We're interested in building things that are usable and make sense for technology developers, practitioners, etc., that feel like they have a practical use. So that was really the thinking behind our methodology. And importantly, they provide opportunity for critical discussion and two-way dialogue between affect developers and affect the communities. And they also provide an artifact of these conversations for kind of stable viewing both now and in the future. And we believe that a process like this will actually ultimately help help developers build better products in engaging with patients, members of the public, provide a kind of early insight into how that technology is viewed and the kind of use for certain communities, that particularly in the context of healthcare, that might not happen until way down the line when you're looking at kind of clinical testing, for example. So to give a little bit of a background for this project, so as I've said, it's a research partnership between the NHS AI Lab and ADA, conceived way back in summer 2020 as the kind of a first of its kind almost to explore the potential for algorithmic impact assessments in a real life healthcare case study, which is the National Medical Imaging Platform. The National Medical Imaging Platform, or the NMIP, as I'll probably refer to it throughout this presentation, is a proposed kind of national scale data set of medical imaging images, so CXRs, MRIs, etc., that was is being scoped after the perceived success of a kind of smaller database that was used just in the early COVID response called the National COVID Chest Imaging Database. So the idea is that this is a data set with kind of broad geographic and diagnostic scope that public research labs, private technology startups can apply to access patient data to train AI products or to use for research testing. So this was a really exciting project for us, partly because it builds on some of ADA's existing work on methods for assessing and inspecting algorithmic systems, and also reflects this kind of growing tide in interest around kind of algorithmic accountability and what those mechanisms might look like. So I've linked here the Centre for Data Ethics and Innovation. I've got a kind of AI assurance guide, which explores the question of what a kind of responsible ecosystem of AI use might look like. So we see a specific tool like this is sitting in kind of the broader ecosystem, if you like, beyond just healthcare governance, healthcare AI governance. So yeah, the bulk of the fieldwork took place last year, and we released the report and the findings earlier this year. And excitingly, the Department for Health and Social Care have committed to trialling the AIA within the National Medical Imaging Platform context. And they have started resourcing as far as we were. That's the latest update, but final details of implementation are TBD. Oh yes, I've skipped ahead of my slide and we've gone through. But yes, the NMIP, I think they're hoping to release it next year. Again, don't quote me on that, but it's still just to flag that it's still very much in development. It doesn't actually exist as a thing yet. So now I would like to talk a little bit about the process that we designed to sit within this NMIP data access process. But firstly, to note that in this kind of algorithmic impact assessment case study, we needed a kind of, I suppose, a source of legitimacy or a governance piece to ensure that the AIA that's being completed is done with care and is able to be kind of assessed to ensure the kind of sanctity of the patient data, obviously being held by the NHS. So the NMIP, they have an existing data access committee that for the COVID database were used to kind of assess applications to the data set on the basis of like technical feasibility and those sorts of more economic questions. But we've recommended that the NHS use them to assess the algorithmic impact assessments as well, to provide that kind of external scrutiny and build in that dialogue between the kind of internal team stakeholders and the external team stakeholders. And this also follows the kind of general algorithmic impact assessment literature, which suggests that an accountability mechanism or a source of legitimacy is needed to give the process teeth, I guess. So we've made some recommendations to the lab about the makeup of the National Medical Imaging Platform Data Access Committee. It's kind of wordy. Ideally, it would have diverse membership and a mix of expertise from the social sciences, the biomedical sciences, computer science, AI, legal experts, and importantly, a couple of patients that would sit on this committee, which was something that was missing previously. So I'll tell you a little bit about where they come into the process now. when I'll walk you through our 7-step process. It's going to be a bit of a whistle-stop tour, but I'm very happy to take any questions on any of the steps at the end. So there's kind of a step 0 for the process. So that's the point in which a team, so that could be a medtech startup, that could be a research lab, decides that they benefit from accessing this NMIP dataset for their proposed AI system for research. So that kind of kicks off the process. And the first thing that gets completed is exercise 1, which is what we call the reflexive exercise. So this takes inspiration from a more kind of the traditional elements of an impact assessment, where it's almost like a questionnaire that gives a series of prompts asking teams to consider kind of common ethical considerations in healthcare and in healthcare technology. And it's a kind of first go for some of the developers and other members of the team in kind of working through some of these ethical questions and thinking about applying them to their specific product or system. So this gets captured in what we call the artifact of the AIA, which is an AI template. So there's kind of a first, there's like a little, maybe like an extended team meeting where everyone huddles and gets together and has to think about this exercise. And that's the kind of first iteration of the AIA in this process, if you will. And then step 2, there's a kind of application filtering. So this first piece of the AIA goes to the data access committee, where it'll get kind of filtered through whether the team has kind of adequately considered societal benefits, ethical considerations, etc. And if they've kind of meaningfully engaged with the exercise. And if they, in this case, let's say they're successful, the team will pass on to taking part in a participatory workshop. So this is the participatory component of an algorithmic impact assessment. We heard lots of kind of discussions about it would be good for kind of a broader segment of society to be able to participate in something like an impact assessment, but we weren't really seeing any kind of concrete methodologies for doing that. So we work very closely with ADA has a public engagement and participatory research wing. So we worked very closely with them to design a kind of citizens jury style workshop, which allows patients and members of the public to deliberate and discuss some of the proposed harms, benefits, ethical considerations of the AI system in a kind of informal, comfortable environment. And the team will be expected to kind of attend that session as well. The sessions are run centrally by the NHS, and they'll likely batch applications so that there's kind of like a session of a few going on at the same time, but one application will do one workshop, if that makes sense. So after the participatory workshop, the teams will be expected to regather, and there's a process of synthesis. So the new evidence and the findings from the workshop are expected to be incorporated back into the AIA. So the idea is that you get a much fuller looking document to then give back to the data access committee at step 5, where they'll make a final data access decision, not just on the basis of the AIA. There'll be kind of other considerations that the DAC might decide to accept or decline an application, which are kind of out of scope for this study. But assuming the application is successful, the AIA then gets published on a central repository, so likely to be the NMIP website, for that transparency piece, so that regulators, civil society, patients, other interest members can view and look at the AIAs completed. And the idea is that the AIAs are published with a member of the team's contact details so that they can field questions from these individuals. And also the Data Access Committee might also publish kind of annual reports around some of the AIAs that were and weren't published to allow for kind of ongoing learning. And then finally at step 7, there's the iteration piece. So as I said before, this is a living and breathing exercise. It's not just supposed to be a little template pamphlet. And so we recommend that this exercise is revisited every 2 years, both to allow for possible new team members to come into the fold, and also for some systems that might be a post-deployment context, in which case learnings about how the system operates in the real world can be then incorporated back into the AIA for future learning. So that's the 7 steps. I'll go through a little bit more about the 2 individual exercises. So the reflexive exercise is split into 4 sections, and then it's designed to help teams work through the kind of possible impacts writ large of their proposed AI system. So the first bit is kind of space for the team to think about their kind of mission, their goals, their values as a team and an organization, and allows for thinking about how the ethical considerations might kind of plot onto those goals and mission. Number 2 is common ethical considerations. So this section encourages applicants to consider how their project might view consent, surveillance, healthcare inequalities, so quite meaty ethical concerns, but we've tried to couch the language in quite kind of tech-friendly parlance, I guess, to rather than just throwing kind of broad ethical principles out and expecting engagement. Step 3 is the kind of impact identification scenarios exercise. So we've asked applicants here to identify what the kind of best and worst case scenario for the use of the AI system might be, both when it's working as intended and when it might be failing in some way. And also the kind of the middle point, what's the kind of standard humdrum everyday use case for this system, because as the sort of most likely scenario that the system's going to be in. And also thinking urging teams to consider the sort of likely kind of institutional or socio-environmental hurdles that might be that might arise that in order for them to meet that kind of best case scenario. And lastly, there's a potential harms analysis piece. So teams will then decide which of the scenarios that they've identified above might cause the most harm, and crucially for who, knowing that kind of impacts are not distributed with parity. And there's space in the template as well for teams to put in place kind of possible mitigation steps. So while the AIA is a kind of diagnostic tool, it's kind of ex ante, it's before the system is kind of put into use. We do urge teams to think about what kind of levers can be pulled in the sort of ongoing development process where necessary in order for some of these findings to be incorporated back into the system design. And then, a little note about the participatory workshop. So, as I said, it's based on a citizens jury methodology and will be run by the NHS AI lab just to kind of reduce that kind of burden and resource costs that are quite considerable for exercises of this nature. So the idea is that a panel of about 25 to 30 people comprising both patients and members of the public will sit as the kind of master panel, I guess, and then for each workshop, 8 to 12 of these are kind of siphoned off to deliberate on an applicant's AI system in a formal workshop. There'll be a facilitator there, and note taker, some critical friends to provide a kind of more well-rounded picture of a system of this nature. Participants will attend a prior induction to explain their role and about AI and applications of AI in healthcare more generally, given that we know we might expect kind of varying degrees of digital literacy and understanding of technology in healthcare. And I want to talk a little bit about some of our research findings that we surfaced through interviews with innovators. So innovators were really interested in this work, and they were really interested in thinking about kind of actionable ways to consider societal implications of their work, and also to do more public and patient participation, which is held in very high esteem in the healthcare sector, as I'm sure you all know, but it is challenging to complete kind of on the ground. Particularly what arose was the access to participants and the kind of capacity to do some of this work. So we really wanted to kind of plug that gap and sought the NHS AI Lab's help in setting up this participatory panel to ease some of the burden on kind of individual applicants. So that was a big thing. And then also particularly many folks were worried about whether this process might duplicate existing regulatory steps. We had lots of people asking about how this might sit in the kind of NIHR medical device classification system, for example. And that was a really big piece for us to ensure that this AIA adds value to that. It builds out an understanding of kind of risk from the quite binary low risk, high risk AI system. We wanted to build out more of a picture, and we hope that this process is actually an enabler for innovation rather than a hindrance. And then, lastly, just ensuring that we use accessible language for kind of techie folks who may be less familiar with the kind of AI governance language that's kind of espoused in the sector. And lastly, and then I'll stop talking, I wanted to have a little note to think about how an AI might mitigate digital health inequalities. So I think I've mentioned it a lot already, but kind of the iterative tools and frameworks that have a kind of clear use schedule and are able to be used kind of by a broad range of people, and that provide this kind of output, this thing that's produced. There's not just been kind of siloed discussions around ethics and healthcare inequalities that then don't lead to anything. There's an actual output for these considerations, which I think is really important when thinking about how digital health inequalities pervade throughout the sector. And we firmly believe that public participation exercises can reveal new possible harms. So therefore, that will hopefully go some way in mitigating the kind of exacerbation of existing healthcare inequalities. And also, it gives members of the public opportunity to discuss their experience of healthcare, which also is really valuable lessons. And often there is not the space for folks to do that at present in the sector. And lastly, I think this is important given the NHS context, that an AIA gives patients a kind of a vote of confidence that teams who've completed one have kind of adequately and meaningfully confronted possible societal impacts and inequalities. They're using NHS public sector data. They've got assurances, members of the public have assurances that these kind of considerations have been thought about, and there's been a kind of thorough examination of healthcare inequalities. So I think that's it from me. I'll stop sharing, and thank you very much for listening. And I'm very happy now to open up the floor to any questions.